We're back with another To Your Wellbeing segment with Dr. Jason Matthews. He's a sports medicine provider for Cone Health at the Mebane Medical Clinic. He's talking about his day-to-day life and what it looks like. And I'm curious, what is the most common kind of movement injury you see?
Great question. To be honest with you, there is not too many common ones. It's all kind of based on the patient. I'll see a lot of things where it's simply a knee acting up from, walking around too much,
Feel
hitting
that.
the shoulder from pulling on something. And so we see and treat everything, but anything that's bothering the patient, it's very important to us.
You know, in our house, instead of a swear jar, we have a jar where anytime we say, ugh, when we get up or sit down, we put money in it. How do you know when it's just like a common aging pain or one that needs to get checked out?
Yeah, great question. Typically, if something is pretty severe to where it doesn't feel like a pain you've had before, or maybe it is that kind of, swear jar pain that you're just feeling for a lot longer than you normally do. Anything that is kind of a change from your baseline or a pain that just, you'd rather not have, those are all great opportunities to come check in with us.
What steps can people take to prevent injuries?
Great question. So, movement is medicine. So a lot of times we in sports medicine are trained to assess things like biomechanics, basically how the body's moving. Make sure that, it's moving in a good way, that muscles are balanced front to back, joints are as loose and as limber or as stable as they need to be. And if that seems overwhelming, that's okay. That's normal. We take care of that. We don't want our patients to worry about that. We just want to make sure that they're safe and healthy, and we can outline a good game plan to do that.
What type of moving should people be doing? Is walking enough, or do we need to actually be going to the gym?
Oh, great question. To be honest with you, we will take, and the data supports this, any amount of movement and activity. We've got guidelines that we recommend, but it's not really something where it's all or none. Even if, you can only get out a few times a week, that is an excellent change. And have that sports medicine as part of primary care, we're all happy about that because that means that you're benefiting not only the joints, the muscles, but your heart, your lungs, your body's going to be happy to get it moving.
I think a lot of people might be shocked to hear that sports medicine is part of a primary care. Why is it included in that group?
Well, I'm sure most of your viewers have been to their primary care doctor to check out their joint and so forth. Sometimes, seeing somebody from a surgical realm might raise the concern that surgery is something that they may only offer. But most, sports medicine, especially primary care sports medicine, it is a natural evolution of what we do day to day in primary care. We just have some extra, training in that light so we can kind of help out that primary care and really offer the latest and greatest of what technology and research has to offer directly to our patients right here at home in your backyard of the Cone.
The whole goal is to keep you safe while you're out there moving about. So as we're entering another hot week in the Triad, what can people do to stay safe in the heat?
Yeah, and it has been a hot one. The great ways to keep safe in the heat are, I would say, number one, hydrate. So you want to be in tune with your body. Everyone's guidelines are going to be a little bit different, but just to make things easy, hopefully this is not TMI, but you want to check and see how your urine is. You don't want it to be too dark or too light. That's a really good real-time assessment of how much, hydration is going on. On top of that, I would say just as important, if not more so, is sun protection. Out here in North Carolina, we get a lot of sun, and ideally you want to use some type of sunscreen that provides protection SPF 15 or more. And, quick mistakes that a lot of folks can make is not applying either enough or early enough. So you want to get that sunscreen to any sun-exposed areas, including maybe some bald spots around the ears, any sun-exposed skin about 30 minutes before activity. If you're going to be doing a lot of activity that involves sweating or the water, you want to reapply about an hour, into that activity.
We can all be better at sunscreen for sure. Thank you so much for all of your advice. If you missed any of this, we're going to put it all up on our website. You can find it posted on WFMYnews2.com in just a few minutes.